going to give everybody an unscheduled 5-minute break, and I'm going to do my speech while you're all gone. I'm a nervous wreck, and I was trying to make myself laugh and make everybody else laugh to calm me down. I'll share another quick story I shared with one of the other advocates earlier that the last time I was up on stage, because my mentor here, Jamie in the front seat, said, "Oh, no, Lisa, it's no stage. You'll be all right." And I said, "But you said the word stage." So the last time I was on stage was when I was in 2nd grade, and I was asked to be Mrs. Santa Claus. And I was not the first Mrs. Santa Claus they chose, because the other little girl got sick, and so they asked me to step in. So I said, "Sure, what could possibly go wrong?" Famous last words. So I was a skinny little girl back then, and unfortunately they did not accommodate the outfit to me, and my pants fell down in front of the whole audience. So that's why I'm standing behind the podium, because hopefully that doesn't happen today. So, oh dear. All right, I think we needed a laugh, so there we go. So my name is Lisa Mitchell, and I'm 53 years old. I'm a medical practitioner, a caregiver, and a patient. I'm from Syracuse, New York. I'm sorry, I said I wasn't going to cry, and I'm already crying. I'm not even. I've been waiting for 6 years to come and say what I have to say, so I'm sorry. Oh. I'm from Syracuse, New York, and in the past 6 years, 4 out of 6 of my family members have been diagnosed with a very rare aggressive form of cancer. My parents also had cancer. We strongly believe this happened due to toxic waste flooding our home. Honeywell and a lot of big companies dumped all of their chemicals into a lake behind our home, and it drained into a creek behind our house and flooded our basements and our streets. Dozens of people have died or are currently living with cancer in our old neighborhood. My diagnosis is called cholangiocarcinoma, otherwise known as bile duct cancer. 3 out of 100,000 people per year get diagnosed with this, making it very rare, and has a 10% 5-year survival rate. But someone has to be in that 10%, and gosh darn it, it's going to be me. Last November 2nd, I was told I had 6 months or less to live. And I said to the doctor, "Thank you, but bye, I'm going to Sloan Kettering." So I did, and they gave me much more hope and said that there are people living with this for years. Having a rare cancer makes it so much more challenging than other cancers. It often takes a long time from initial symptoms to time of diagnosis. There are a low number of doctors treating rare cancers, and therefore hard to find a doctor and how to treat it. This becomes very overwhelming to the patient when doctors don't agree on how to treat your cancer. I would like to break down the areas of the cost of care to financial, physical, psychological, and social-emotional. In the area of financial, I had just started a brand new job and had to quit after a few weeks due to impending surgery and subsequent chemo. I had paid into the short-term disability and long-term disability. Sorry, I looked up and then I got distracted. I keep looking down. I'm sure. I had paid into the short-term disability and long-term disability programs for 24 years as an occupational therapist. And unfortunately, because I just started a brand new job, they told me, "Gee, we're awful sorry, we can't help you because there's a 12-month pre-existing clause." So I've been out of work for almost a year. I could have gotten 60% of my salary while I was battling this. I have not been able to work due to being an occupational therapist, being around infectious diseases, and the oncologist said absolutely not. Another thing that was very difficult for us is that I had to battle with my insurance company for more than a couple of months because they were telling me they weren't going to pay for my chemo because I said it was just a pill instead of an infusion. And they didn't believe it was chemo, despite the fact that the doctors wrote letters on my behalf. Eventually, we were able to get help with this through the Cancer Copayment Assistance Program, and thank God for them. Otherwise, I would have had to pay $2,400 a month for my chemo. Having a rare cancer, having to travel so far because I live in New York and I go to MD Anderson in Houston because it's one of the only places that treats this, and need to be seen by a specialist, as there's only a handful of them for this. Obviously, everything we've already talked about today, so I'm repeating everything everybody's saying, but the cost of travel, cost of hotel, food, transportations to doctor's appointments. My husband travels with me and has to use all of his vacation time, which causes a lot of mental health stress, as we have no time left over for a cancer-free relaxation of any sort, which also causes me stress. All of the above resulted in now living off of credit. I should be looking at the age of 53 towards retirement. Instead, we're living paycheck to paycheck and in debt. I was blessed enough to receive Social Security disability and had no fight because it's considered a terminal cancer diagnosis, so they put it right through. So that was wonderful, but also terrifying, knowing that that's how serious they take this disease. I've had 24 wonderful years as an occupational therapist paying into the Social Security system. I'm very grateful to be getting something. However, it's about 1/5 of what I normally make, and therefore not enough to live off of. My prognosis is poor, so I would like to work on a bucket list, but unfortunately unable to afford to do that. So now I'm left with, do I work or should I work on my quality of life? Now any job I get, because I have a cancer diagnosis, isn't going to touch me for short-term disability, long-term disability, and certainly not life insurance. In the area of physical, I'm unable to sleep due to stress with so much on my mind. Lasting side effects from chemo, which is there's a thing called chemo brain, and that is difficulty following directions, processing of information, memory, numbness in my fingers. Also, due to it being a rare cancer, there's a lack of research, which thus puts a lot of pressure on the patient needing to do their own research and education, which results in mental and physical exhaustion. Does anybody have a Kleenex? He's taking lots of pictures of me, and I really don't want that on there, so please don't. Okay. Don't use the Zoom lens, whatever you do. Okay. Don't use Zoom, whatever you do. Oh my gosh. Oh boy, I'm happy I can provide some laughter. I'm usually good for that, so. Oh, so where was I? And then the other thing is too, in the area of physical, is just needing to do extensive planning of each day logistically, because I don't know if I'm gonna have enough energy to do everything I want to do, let alone what I need to do. In the area of psychological, I have a constant fear of dying. I go to bed thinking of dying. I wake up thinking of dying. And frequently throughout the day, I think about dying. I'm always waiting for the other shoe to drop. I'm constantly assessing every situation. Should I eat this? Should I drink that? Should I use this lotion? Should I not use this lotion because of the chemicals? It's exhausting. Anytime I want to travel anywhere or just daily, I want to make sure I'm near a major hospital in case, God forbid, anything should happen to me, and it's exhausting. All the things I used to take for granted, I have to overthink all the time now. I strongly believe that all of us with cancer and chronic illnesses, PTSD doesn't just affect service men and women. It's equally disabling, having cancer and all that comes along with it. I am getting to the end. Socially, emotionally, one of the biggest things for me is because my 3 siblings have their own journey, so we can't even support each other. We're all on our own parallel journey, and that's really difficult. I've lost many friends once they've heard that I had cancer. Nobody wants to stick around now, and they say, well, you look so good, so you must be okay. Or you had surgery and chemo, so you're fine. So that's led to many people pulling away, which results in depression for myself and my husband, and affects our overall ability to cope and decreased immune system for fighting this overall battle. Last page, woohoo. In summary, 6 years of advocating for my siblings and being their caregiver has left me exhausted. Although so rewarding, now I don't have the energy to battle what I need to do for myself. At the end of each day, while I'm done with everything At the end of each day, while I am done with everything I spoke about in this speech, I don't have energy for everything I need to do, let alone what I want to do. I hope that we can continue to have access to health care for everyone, make sure pre-existing conditions are covered, Social Security disability continues to be available for all patients. And then lastly, I found out I was speaking to another advocate in the audience, and I'm so sorry I don't remember her name. As I was talking to her and Kobe, it dawned on me that today is the anniversary of my medical journey, my 1-year anniversary. So I strongly believe that I was meant to be here today. So thank you so much for giving me the opportunity.